I have the privilege to review this book by Dr. Sunil Anand, Accuracy of 10 W's in Homeopathic Case Taking, an extension to the 7 W's of Boninghosen. It's a book by B. Jain and Publications. Now, what I have found very striking in this book, and it is something that is rare in homeopathic books, is the extensive interviews which have been verbatim put in by Dr. Sunil. And I think that these are wonderful educational techniques. This strong point in this book can tell us how children are to be interviewed, more important, how they are to be observed, and what was most interesting is how their play and how their art and how their doodling can be utilized by the homeopathic physician in his case taking. Play therapy has been a known aspect in child psychiatry. But for a homeopath to be able to use these techniques in a very, very creative way, and how he will be able to utilize the different observations and build up a totality. And that is the second unique part of this book, that Dr. Sunil Anand is using the well-known Boninghosen's method and the 7 aspects which Dr. Boninghosen spoke of, about the why, the where, the when, the what, the who, the what effects, and with what. So these are classical aspects of analysis from the Boninghosen's method. And what Sunil Anand has very creatively done is he has added 3 more aspects, and which are very important. He's talked of observations, how to integrate observations of a child in the totality. And the second is not so much of a totality, but the 2 aspects are processing of the totality. One is trying to spot the kingdom, the remedy, the kingdom from which the most likely simillimum is likely to come in. And the third aspect, the 10th aspect of the 7 W's, the addition, is the analysis of the intensity, the pace, the pathology, what we would normally talk of, the details of susceptibility. And when one is able to put down all these, the unique part of it is that all the interviews have been converted into these 10 aspects of Boninghosen's extended analysis. And I think that that is a very, very unique part of this book. It is something that not only homeopathic physicians, but especially all postgraduates who are studying homeopathic pediatrics as well as homeopathic psychiatry will be able to benefit from. It's a very, very readable book. It is, the language is very easy, and Dr. Sunil Anand, with all his extensive experience and his experience of Dr. Rajan Shankaran, he has worked with a lot of well-known figures in the homeopathic world, and he has been able to bring together all this experience and knowledge. For example, when he is right in the beginning, he talks in terms of how each case has to be looked at from its pathology, from the source, from the group study, and from the way in which the physical symptoms need to be tagged on to the mental symptoms or to the group study. So it is something that is very sound in its approach from the angle of homeopathic philosophy, as well as it gives a true operation of how we need to really scientifically practice and bring about results. There are a few issues which one would like to look at. Especially he has given some cases which are very having a deep pathology, and the solution of it is not very clear because the follow-ups are not adequate. But that is a minor aspect. The number of cases that have been given are really very heartwarming, and I would recommend this book very gladly to the homeopathic profession.